Comonal from Group 18, and today I am going to do my return demonstration of preparing a medication in a vial and intradermal medication administration. Okay, to start, of course, the first thing that we have to do is to check the doctor's order. Okay, of course we are doing this because here we will be able to find the patient's name to whom this prescribed medication is intended to. And also, here we'll be able to find all about the medication that we're going to administer, about the dosage, the frequency, the route, and the time that it is to be given. Okay, I see it all here. And now we also check for the medication administration record, or the MAR. Okay, because here we'll be able to see if the patient or this patient has history or any allergies to a certain drug, and also a list of medication, previous and recent medication that have been administered to this patient. We will be able to see it here. Also, that's why it's very important that we also check for the record, the MAR. Now, for us to be able to know if there are things that we have to consider before we administer the prescribed medication of the physician. Okay, because especially if this prescribed medication is actually contraindicated to the drug that's already been in the patient system, so we might consider to hold before we prepare the medication, the prescribed medication, and we're going to relay our concern to the physician before preparing and administering the medication. Okay, now that I actually see here in the MAR, okay, my patient for today doesn't have any allergy on drugs, so I think we're good. And now that I know all about the medication that I'm going to administer, so I'm getting now the medication from the medication card. Okay, so as if I have medication card here, and I have a key. Okay, I'm going to open it. Okay, open it. And now I'm going to do my first check. Okay, I got the right vial or the right medication. Okay, because we have actually to observe and follow the 3 checks of medication administration. We're going to first check or read the label when it is taken from the medication card, and then we're going to check again before withdrawing the medication, and then check again after withdrawing the medication. That's why. Okay, now that I have got the medication, now I'm going to proceed in also getting the equipment that we're going to need in preparing for this medication. So as you can see, I already have it all here. I have the needles, the filter needle, the syringe, the antiseptic wipes, the alcohol, the clean working gloves, the medicine tray, and also I've got here the pen that we'll be using. Okay, so now that I have organized my equipment, so now I am good to go in the preparation of medication for drug withdrawal. Okay, of course, I'm going to be doing the hand hygiene. Okay, and I'm also going to don my gloves. This is for the infection prevention, of course. Okay, now that I have put on my gloves, I'm going to, of course, before we open the container of our medication, we're going to be mixing the solution inside of it. So I'm going to mix the solution in this way. This is a proper way, and mixing the solution inside the vial. Okay, we're going to rotate the vial in between the palms of both of our hands and not by shaking. Okay, now that the solutions are mixed, okay, so now I'm going to proceed in uncupping the vial. So I'm going to remove the protective cup if present. Okay, so as you can see, this vial doesn't have a protective cup on it. Okay, so I'm just going to still demonstrate it. Okay, so in opening or removing the protective cup, we're going to just flick it off like this. Okay, so imagine if there's a protective cup there, so we're going to flick it off. So now it's removed. So now that the protective cup is removed, now the rubber cup is exposed. So now we're going to proceed in wiping it with the antiseptic wipe. Okay, in circular motion. Okay, I'm going to discard that into the proper receptacle. And now I'm going to prepare for the syringe. Okay, I'm going to be attaching now the filter needle into the syringe so that we can proceed in withdrawing the medication. Okay, so we're just going to make sure, going to turn it. Okay, so we have to ensure here that the filter needle is firmly attached to the syringe. I think we're good here. So now I'm going to uncup the needle. Okay, so I'm just going to leave this here. And now I'm going to draw up air into the syringe, the same volume. The same volume to the medication that is to be withdrawn. Okay, going to be at the 0.4. Okay, so now that we have withdrawn air, I'm going to inject the needle now into the vial. Okay, so we have to stabilize our hand here and to steady our vial with our non-dominant hand. Okay. Okay, so we're just going to maintain sterility. Why? That's why we're doing and stabilizing our hand. Okay, so I'm going to. Okay. Okay, so now that I've injected the needle, we just have to make sure you know that the bevel is above the level of the medication. Okay, so that's why. And now I'm just going to actually. Okay, withdrawing now the medication, the prescribed amount of medication. Okay. Okay, and now I'm going to be removing the filter needle, the used filter needle. Okay, I'm going to discard that, and I'm going to be replacing it with a new one for the Okay, so now we have the prepared medications. I'm going to actually put it in here in the medication tray. Okay, and now with the medication sticker. Okay, and I'm just going to discard what needs to be discarded, and also going to discard the used gloves. And for hand hygiene, now that we have prepared the medication, we're good to go to administer it to my patient. Okay, so let's go. Yes, if now we are in the patient's room, in the front of patient's room. Okay. Good day, ma'am.
Good day.
Okay, this is the psychologist. Good here. Ma'am, I am Comonal. I am a second-year nursing student from Davao Doctors College, and I am your nursing student for today. How are you feeling today, ma'am?
I feel good.
Okay, that's great to hear, ma'am. Can I see your wristband? Okay, thank you. Okay, please state your complete name.
I'm Bernadette G. Comonal,
Okay, and your birthday.
March 19, 1976.
Okay, thank you very much, Ms. Comonal. How would you like me to address you?
Just call me Nadette.
Okay, Nadette. Nadette, I am here because I'm actually going to do a skin test to you. We're doing this because for us to be able to know if you are allergic to this drug, because we're actually going to administer the drug or the medication later today. And Nadette, in doing the skin test, it actually involves me injecting a needle in this area of your forearm. I'm going to inject the needle on the surface of your skin. Okay, and Nadette, here. Yes, of course, you will be feeling a small prick when I insert the needle as it enters your skin. And we will be creating we'll hear it like a blister. So would that be okay with you?
Yes, it's okay with me.
Okay, so thank you. So, and then that, after we have created a blister, I'm actually going to trace that with a pen. But don't worry, I'm actually going to use a non-permanent ink pen. So would that be also okay with you?
Yes.
Okay, thank you very much. You know that, just wait a second. I'll just make sure now that the doors are closed and the curtains are down and draped. Okay, I think we're good here. You know that, can I see your right arm? Thank you. And your left face. Okay, put down that. I'm going to use this. Okay, Nadette, do you feel any pain in this area of your right arm?
No, it's
Okay,
normal.
thank you very much. Okay, as soon as I have provided my patient's privacy, what I'm actually doing here now is I am selecting the site for the injection. So the site is the forearm, no? Hands width just above the wrist, and 3 or 4 fingers width in the antecubital space. And also, I have asked my patient in selecting for the forearm or the site for the if there's tenderness, because in selecting for the site, we must avoid in using the area or the arm that has a presence of or that are tender, of course, inflamed and swollen, and if there's presence of lesions there, of course, we don't want to inject in those areas. So that's why. Okay, now that I have actually selected a site, so now I'm going to proceed in gloving my hands before I administer the drug. And then, now I'm going to start. Okay, so since I've now selected or located my site of injection, I'm going to wipe it with a antiseptic or antiseptic wipe. Okay, circular motion. And I'm going to discard that. And now, while we are waiting for it to dry, I'm going to open up my needle. And if there's a like air bubble present, then we're going to be flicking that slowly. Okay. Okay, and now that it is dried and we are good to go, so our dominant hand now will be the one to excuse me. So I'll just be in for this demonstration. I'll be using a in eggplant. So now our non-dominant hand will do the stretching. Okay. We must make sure that the bevel is up. Okay, and I'm going to inject it. Okay. You can see while I am injecting for the intradermal, in injecting we have to stabilize our hand. So by holding our syringe in the barrel closer to the top with our dominant hand and holding it like this, okay, with our thumb and index finger, and our non-dominant hand, as you can observe earlier, will do the stretching. That is to like I'm going to demonstrate that, and the bevel is like facing towards me. So going to again non-dominant hand and injecting that, and the non-dominant hand that will do the navigating so that the dominant hand will not move, so stable, and the push the plunger and quickly remove the needle, no, at the same angle as we have inserted it. Okay, so I'm just going to discard it, or just going to be placing it here. Okay, now that I'm done, don't massage the area. Okay, it will dispense the medicine to other tissues. So don't massage the area. Okay. Okay. So now I'm going to discard my gloves, and I am going to the proper receptacle. I'm going to perform hand hygiene. Okay. Okay, to that, I'll be drawing now or tracing now the blister. Okay, as if know that there is a blister here. Okay. Okay, to that, please don't massage the site of injection, okay? Because it will dispense the medication into the other tissue. Okay, so don't massage that. And to that now, I'll be heading out. So do you want to, if there's any clarification? None. Okay. After that, I'll be back after 30 minutes. I'll be reassessing the site. So please don't remove the tracing of the pen. Okay, so thank you very much. I'll be back. Okay, now, as if it's now, it's been 30 minutes already. Come here. Okay, Minadette, I'm back. So can I see your hand? Okay. Okay, now we are going to assess now for this site or the blister, for redness and induration in the limiter. If the redness actually, or the actual blister actually will go beyond our border that we have traced, then we have to actually test or see now that our client is positive or negative for the skin test. Okay, so we are going to documentation. Okay, we are going to document the material that is given, the route, the frequency, the dosage, and also the time. Okay. Okay, and signature. Okay, that's thank you very much. I'll just leave you to rest, and if you have any concern or if you need any help, so just press the call button, okay?
Yeah.